Today I'm going to show you how to do a dressing change using aseptic technique. Typically, when you're changing a wound like this, you'll have them on their side because that's typically more comfortable for a patient to lay on their side versus their stomach. However, for demonstration purposes, we're going to have this guy laying on his stomach. That way you guys can see it. Alright, so to begin the dressing change, you want to do your pre-procedure steps. And you want to make sure that you assess your patient for pain. Let them know that doing a dressing change can be painful, and that if they're having any pain right now, we can go ahead and medicate them 30 minutes before the procedure actually starts, just to get them a little bit more comfortable. Once we've medicated, we return in 30 minutes. Now we're going to put on clean gloves and we're going to remove this dressing that's currently on the patient. So you're going to gently loosen the tape to remove this dressing. Be very careful that it's not stuck to the patient. And then as you remove this top dressing, you want to look for drainage. So you want to inspect all of your dressings. You want to look for type of drainage, amount of drainage that's on this, and then you can discard it. And then with your clean gloves on, you want to pull out all of these gauze. While you're pulling out these gauzes, you're also inspecting drainage. And if you had a gauze that was stuck to the patient, it was really pulling on the patient's skin, you can moisten this gauze with sterile saline to help loosen it up to prevent further pain to your patient. And you'll discard all of those, of course, after you have inspected them for drainage. Now that we've got all of our dressing out of our patient, we're going to look at the patient's wound and the skin around the wound. So what we're looking for is any signs of infection. We're looking for new granulated tissue to make sure that it's healing. So we're assessing if it's healing. And then we're also going to look to see if there's extra drainage in there, if there's slough, eschar, pus. We want to know what's going on with our wound. We also want to look around our wound to look for any skin irritation that may be caused from the dressing rubbing or from the tape. Now that we're done inspecting, we're going to take our dirty gloves off, we're going to wash our hands, and we're going to grab our new supplies. So here we actually have a sterile wound care tray, which is fine. It should have all the supplies that we need in it. We are going to use this kit. We're going to maintain asepsis, not necessarily sterility. However, when we open this kit, we will have a drape in here. So we do want to use this drape. That way we have a larger field to work with to keep our supplies clean, because we do not want to put anything dirty into our patient. So we want to make sure we keep it clean. So we're going to take our drape, grab the corners, lay it out on our bedside table, and then from our kit here, we can move our supplies to our drape. This drape just allows us an extra large working space. That way we can keep everything clean. So we can just set our abdominal pad, our gauze, we can set our tape out. We have a Q-tip, and it's nice to mention that this Q-tip does have a measure tape on it. And then your kit also comes with another device for measuring. And then it has sterile normal saline. So we're going to go ahead and pour our saline into the container. So we're pouring it in. And since this is still clean, we haven't touched it on anything, we can also set it down onto our drape in case we need some more. So now that we've got our supplies all set up, we can begin cleaning this wound. So we're going to take a few pieces of gauze. How many do you think you might need? And we're going to sit them in our saline so that we can clean our wound. So just gently pick up your gauze and try to pick them up by the corners. You can squeeze it out and see we haven't touched the part of the dressing that's going to touch our patient. So we're going to take our gauze, start in the center of the wound, and wipe out. And we're going to throw that away. So pick up our gauze, holding the corners, center of our wound, and wipe outwards, and throw it away. So each gauze gets only one swipe. Once our wound is completely cleaned, we will go ahead and change our gloves, get clean gloves on. And now if we were going to irrigate, we would irrigate with sterile techniques. So we would put sterile gloves on and irrigate our wound. To irrigate a wound, remember I said a patient with a wound like this would typically be on their side. So this patient is on their side. You would take your piston syringe, you would start at the top of the wound. So if they were laying facing me, I would start up here at the top, a back and forth motion, top to bottom, until that wound is completely clean. Again, the patient's on their side, so all of this drainage is running down onto a basin that I have sitting down here, okay? And that's how you irrigate. For checkoffs, you just need to verbalize that you're gonna use sterile technique. You're gonna go in a back and forth motion from top to bottom to allow gravity to pull the fluids down. Now that our wound is clean, we can now, if we had an order to attain a wound culture, we would do that now. And then now we're gonna measure our wound. So I'm just gonna use this, I'm gonna go ahead and take my Q-tip out and lay it on my clean field. Okay, and then I'm gonna use this wrapper right here to measure my wound. So you wanna measure length. So when you do length, think of it like a clock. Your patient's head is the 12, your patient's feet is the 6. So for length, head to toe. And you will measure from the top of the wound down to the bottom of the wound in the widest part. So this one is about 10 centimeters. To do your width, you will do left to right. So you want to find your widest part, which the widest part here looks to be here and across. So we'll go across, and that looks to be 8 centimeters. Okay, so now that is our length and our width. So now to do depth, we will take our Q-tip and we will find the deepest part of the wound. So for this wound, it looks like it's going to be right here. Then you'll move your fingers down to where it's even with the skin, and then you'll just keep holding your fingers there. And then you can measure on your tape how long you think that is, and that's about 3 centimeters. And you'll throw that in the trash. Don't sit it back on your sterile field. And we can get rid of this ruler because we're done measuring. So we'll throw that in the trash as well. Now we are ready to put on medication if there's any ordered. So if your patient has any type of medication that the provider wants for their wound, we would do that now. Now you want to change your gloves, wash your hands, and put clean gloves on. And now we're going to do the wet to dry dressing. So we're going to replace our dressing. So we're going to take our gauze and we're going to put it in our tray. Take our gauze, put it in our tray, and then we can pour normal saline over this gauze. Then when you go to pack your wound, pick it up with the corners, wring out any excess water, and then pack the wound with fluffed gauze. So you want to fluff your gauze out and stick it in your wound, being very careful not to drag it across the skin. So here's our wet gauze. We're going to fluff it out a little bit, and then we're going to place it in our wound, being very careful not to touch the skin. We're going to keep doing this until our wound bed is full. You want your whole wound bed to be full, but you do not want all of this gauze sticking up and over onto the skin. So you want to make sure that it's within the wound, okay? Drain out the excess water, fluff it, and then apply it to your wound. Now this wound does have some tunneling and some undermining. So when you put that gauze in, you can use a clean Q-tip to kind of poke it down in there. Very gently poke it down in there. You don't want to hurt the patient. Once you've got your wet to dry dressing in place, now you're going to cover it with your abdominal pad. Well, first you can put some dry gauze over top of it if you want to. You don't have to. And then you can put your abdominal dressing over top of that. Then you want to take your tape and you want to tape it to close off the border. So you want to just place it right on the border and right on the skin. You want to do both sides. So do both sides, securing it down. And then you want to do it long ways as well. And that's just going to help keep it secure. You'll do all, well, ran out of tape on that one. You'll do all 4 corners. Like so. And then you can take an extra piece of tape, stick it to your patient's wound, to their dressing, put your initials, the date, and the time that the dressing change was performed. And that is how you do a dressing change.